Good morning, ladies and gentlemen. Welcome to the 2021 Annual General Meeting of Clinuvel Pharmaceuticals Limited. My name is Willem Blijdorp and I'm the Chair of the Board of the Directors and the designated chairperson for today's meeting. As this is a virtual AGM, some technical difficulties may arise. In the event of a technical issue, we ask you for your patience as we try to fix it. If the video technology fails, we can proceed as an audio-only meeting. If it cannot continue the meeting from my current location, then my colleague in Melbourne, Ms. Shanahan, will be appointed chair until the technical issues are resolved. If at any stage you have trouble using the online platform, there's a help number displayed on the home page. I have been informed by the company secretary there is a quorum, so I'm pleased to declare the meeting open. I would like to introduce you to Clinuvel's board today. Joining me from Europe is our Managing Director and CEO, Dr. Philip Wolgen.
Good morning.
Also with me, two of our non-executive directors who are up for re-election today, Ms. Sue Smith and Dr. Karen Eggersborg.
Morning.
Good morning.
At our Melbourne office is Brenda Shanahan and Professor Jeffrey Roosevelt, as well as our company secretary and CFO, Mr. Darren Keamy. Online, we also have our audited representative, Mr. Michael Cunningham of Grant Thornton, Australia. Today's meeting will be recorded. I will shortly deliver the share address to the meeting, and this will be followed by the formal items of the meeting, where shareholders will vote by poll and ask questions specific to each resolution. Those directors seeking re-election will also be given an opportunity to speak when the resolution is put to shareholders. We will finish the meeting with an address by the CEO and then receive and answer questions from shareholders on the business. As some shareholders may not be able to stay for the duration of the meeting and to provide you with enough time to vote, I now declare the poll open. You can vote on all items from now until I call the poll closed at the end of the meeting. As the final resolution is a conditional resolution, could you please submit your votes as early as possible? I will now hand over to Company Secretary, Mr. Darren Keamy, to outline the vote procedures along with asking questions relating to the resolutions.
Thank you, Mr. Chair. Hello, everyone. All shareholders and proxy holders entitled to vote and who have logged into the online meeting should see the home page on the screen. You should be able to now see a voting icon at the top of your screen. Selecting this icon will bring up a list of resolutions and it will present you with voting options. To cast your vote, simply select one of the options. Your selection will be highlighted once your vote is cast. There is no need to hit a submit or enter button as the vote is automatically recorded. You can change your vote at any time until the poll is closed by simply reselecting the voting options at each resolution. Your original vote will be automatically cancelled and replaced by your new selection. If you have any issues on voting, there is a helpline which you can call. I now move to the procedure for asking questions in the meeting. You can submit a written question or you can ask a question verbally. To submit a written question, press on the messaging icon. This will open a new screen. At the top of that screen, there is a section for you to type your question. Once you have finished typing your question, please hit the arrow symbol to send. You will receive a confirmation when your question has been sent. When asking a question on a resolution, please put the relevant resolution number in the Ask a Question box to identify the resolution pertaining to your question. You can submit written questions at any time and do not need to wait until the relevant item of business. We encourage you to submit questions as soon as possible to allow us to review and amalgamate if we receive multiple questions on one topic. Lengthy questions may be summarised in the interests of time. If there is insufficient time to answer all questions, we shall respond individually after the meeting to provide an answer. We already have received questions from shareholders in advance of the meeting, and these will be addressed during the course of the meeting. Our non-executive director, Sue Smith, shall read the written questions. To ask a question by telephone, please select the home icon on the Lumi online platform and follow the instructions. The instructions will direct you to a telephone number where, upon dialing, you will be answered by a live operator. When the chair asks for telephone questions, you will need to press *1 on your phone to state your name, location, and you will enter the question queue. An operator will then announce you by name, and you may verbally ask your question. Please note we will be taking telephone questions only at the conclusion of the Managing Director's presentation when questions are open to general business. If you wish to ask a verbal question specific to a resolution, could you please wait until this time and indicate in your question that it relates to a specific item of business. The voting poll will still be open during this time. Please ensure you keep your questions to one question per item of business, and please limit the question or comment to under 1 minute. Finally, please keep your questions to the relevant resolutions being considered today. Please ensure your questions are relevant to the business of the meeting and to shareholders as a whole. I will now hand over to the chair.
Thank you, Mr. Kimmy. The minutes of the last annual general meeting, along with the notice of meeting, are taken as read. Before I move to the resolutions tabled in the notice of meeting, which all shareholders should have already received, I would like to provide you with a short address about the year and that has just passed, as well as a few words about the direction of the company. My fellow shareholders, it's a pleasure to speak to you on Clinuvel's group and how we as a board have seen the developments in 2021. Clinuvel made significant progress on our path to a specialty pharmaceutical group since our last EGM. The company has enabled treatment for more patients than ever before, with our drug Scenesse launched in innovative clinical studies and progressed the development of new products through our Singapore Research Development and Innovation Center. You will hear more from the Managing Director, Dr. Wolgen, on the strategy of Clinuvel, and I'm very optimistic about the path of the company. In particular, as you will have seen, we have positioned Clinuvel for organic growth across our 4 divisions and focused on structure of the group to maximize the value of our investments. This places the company's stakeholders, including us as shareholders, in an optimal position to benefit long term. I maintain 3 active roles within Clinuvel. As an independent chair of the board, I help steer the course of the business and protect the interests of shareholders. I oversee that there is proper management and that the company is able to achieve its objectives long and short term, delivering value for society and for shareholders. It's also ensure our management team can remain focused and supported. In this role, I thank my fellow board members for their work and energy under difficult circumstances during the last year. Both Dr. Karen Eggersborg and Ms. Sue Smith are nominated for re-election this year, and they have my full support to continue their valuable contribution to our board. As chair of the Remuneration Committee, I work with fellow directors and external consultants to ensure we attract and retain the right leadership and that we are remunerated according to international standards, such as the company can continue to compete, generating value long term. Here, I take the view that Clinuvel must encourage entrepreneurship and measured risk-taking in setting remuneration objectives. as this allows us to get the best results from our people. I also wish to eliminate personal risk from the business, but ensuring stability. For me, that's both retention of key personnel and facilitating succession planning for future phases of growth and expansion of the business. Finally, I've made in 2018 on a personal basis a considerable investment in Clinuvel, and I'm determined to see that the value of the company can be realized, not as a day-to-day movement on the share price, but as an entity that continues to grow and deliver results. I want what is best for the longevity of our group. As a board, we applauded Dr. Volgan, Mr. Kimi and Dr. Wright and their team for the company performance over the years, and in particular in 2021. Financial results. In each of our personal and professional lives, we have seen the impact on COVID-19 on business and healthcare. Yet the Clinuvel team not only enabled patients to continue their received treatment, they delivered year-of-year records. It speaks to the drive of the management team and all the people within Clinuvel that they have thrived under adverse conditions, working a 24-hour schedule to deliver for all the company stakeholders. At this moment, I take the opportunity to look forward to the future. As a business, we have both the people and the technology to continue to make an impact upon society. It's humbling for us to learn the life-changing experience of EPP patients who benefit every day from our treatment, and we wish to continue to expand this access, including for children, and of course worldwide. For those living with other genetic and life-threatening disorders such as XP, or the many millions of people who suffer from strokes each year, Clinuvel is actively seeking new solutions where none exist. This is a challenging and fascinating path, but one we have mastered in the past decades with success. Beyond this clinical work, our teams are developing new products, creating new offerings, and establishing Clinuvel as a diversified group. Thank Dr. Volgan, Dr. White, and Ms. Kimi, as well as the entire Clinuvel team for their work this year. I also wish to thank the patients, the doctors, the hospital teams, and many others who have supported our work globally. Finally, I thank you, fellow shareholders, those who share the vision of the board to support a winning team. You will hear more from me throughout the coming year as our story evolves. Now, the informal items of business we are listed on the screen. Please note, as was indicated in the notice of meeting, where undirected proxies have been given to the chair, I will vote these in favor of resolutions 1 to 3 and against resolution 4 should it be put to the meeting. I will now move to the first item of business. The first item on the agenda is to table the company's financial statements and the directors' and auditors' report for the year ended 30 June 2021, together with the directors' report and the independent auditors' report as set out in the annual report. There is no resolution on this item. It is an opportunity for shareholders to ask questions relevant to the conduct of the audit and preparation of the content of the auditor's report set out in the annual report. We have our lead auditor partner, Mr. Michael Cunningham of the Grant Thornton audit present at the meeting. He can answer any question that are relevant to the conduct of the audit and the preparation and conduct of the auditor's report. Ms. Smith, are there any written questions received in this item of business?
There are no questions received on this item of business of the financial reports.
Okay, as previously noted by the company secretary, we shall take telephone questions on this item of business after the CEO presentation. I now propose to move to to the resolution number 1. Resolution number 1 is to consider, and if thought fit, to pass a resolution adopting the remuneration report containing the annual report sent to all shareholders. It should be noted that this vote by shareholders is an advisory vote only. It does not serve to bind the company or its directors. However, the board will consider the outcome of the vote when reviewing the remuneration policies of the company. The directors recommend shareholders to vote in favor of this resolution. Ms. Smith, are there any written questions received in this item of business?
There are no written questions.
Any telephone questions on this item of business will be taken after the CEO presentations. The proxies received in respect of these resolutions are on the screen.
Excuse me, Mr.
Chair. If you haven't already done so.
Excuse me, this is the company secretary here. We do have questions on the remuneration.
Yes. A question has arisen on the remuneration report. If I may read the first question, which is from Mr. Samuel Jed Howard. Resolution 1. The section of the remuneration table states the grant of performance rights based on a $250,000 of revenue from OTC products. Is this not a considerably low target given a company with over a $1 billion market cap? If I could ask, I have been asked to delegate questions by the chairman as we have difficulty with the cameras. And so I would like to delegate this question to Mr. Blijdorp, please.
Yeah, I think you have to mention something to start with. And I agree, it's not a high amount, but it's just a matter that we wanted to express that if there is a start, we can have the question shared with the staff. Okay. So it's not a matter of high or low, it's just a matter of somewhat is starting, and then we can give it a sharing with the staff. I think this is what we mean.
Thank you, Mr. Blijdorp. My second question, also from Mr. Howard. Is the first section of the remuneration pay table based on market cap or performance versus the health index? Mr. Blijdorp.
Yes, I cannot remember exactly what we did, but I think it's on the market cap, which we mentioned in our remuneration. I think where we were looking for that we were prepared to share the interest of shareholders with the interest of the team, and we said if we can reach together a market cap of 7.5, then we are able to share. And of course, if we cannot reach the total, there will be a percentage we consider as a success.
Thank you. I would like to thank Mr. Tollefson, who has given us a comment on the remuneration report, but it doesn't contain a question, and the board will consider your comments, Mr. Tollefson. Thank you.
All right. Anything else?
No, those are the only questions received on the remuneration report. Thank you.
Thank you. I now propose to move to resolution 2. The next item of business relates to the re-election of Dr. Karen Eggersborg as director, who is retiring by rotation in accordance with clause 57 of the company's constitution and is eligible for re-election as a director of the company. I invite Dr. Eggersborg to address the meeting to present why she should be re-elected to the board of directors.
So, excuse me, it's the company. Sorry, it's the company secretary again. Can we put up the proxy results for resolution 1? Okay, they are now on the screen. So thank you. We can now move to Resolution 2. Thank you.
Thank you, Chair. My fellow shareholders, I am delighted to submit my candidacy for re-election as a non-executive director of the Clinuvel board, and am committed to performing the duties of director to support the success of Clinuvel and its products. Indirectly, I've been involved with the company for the last 20 years, and since January of 2018, I've been an active member of the board. The company has achieved some significant milestones during this time, including the approval of SCENESSE by the FDA in October 2019 in the United States. This has been well embraced by adult patients with EPP as well as private insurers, and I am pleased to have been a member of the board to guide the successful commercialization of our drug in the United States. My unique comprehension of endocrinology and metabolism affords me deep expertise in melanocortin physiology, which is highly relevant to Clinuvel's focus in developing melanocortin-based treatments to help those with unmet medical needs. As the company expands its research and development program for the uses for melanocortin, I look forward to providing clinical guidance and protocols for patient needs, particularly in North America, as well as reimbursement of the cost of treatments for Clinuvel's products. The field of human hormones, which is where I live day to day, continues to emerge, and we see the pleiotropic effects of melanocortin therapy. These are exciting areas to explore for the broader use of melanocortins for clinical as well as commercial value. I look forward to contributing my expertise in these clinical aspects of the operations of Clinuvel, while also serving on the remuneration and nomination committees. I feel privileged to have contributed to the company's growth and achievements, particularly over the last 3 years, and to submit my candidacy for re-election. I look forward to your support and thank you for your consideration.
Thank you, Dr. Aggersborg. Ms. Smith, are there any written questions receiving in this item of business?
Yes, we do have one question from a Mr. Simon John Brown. Mr. Brown has asked whether, although Ms. Aggersborg is a clinical endocrinologist, her medical knowledge may be beyond question, but what experience or qualifications does she possess which make her suitable to sit as an independent member of the Remuneration and Nomination Committee of an Australian-listed publicly traded company? In light of her family history with the company, how does she consider herself fully able to exercise independent judgment when evaluating the performance of the CEO and senior management? I have been asked by the chairman, Mr. Blijdorp. He has delegated me to answer this particular question. We are delighted, and I am delighted when I came to the board to realize that 50% of the Clinuvel board are in fact women. And Dr. Aggersborg has skills and a diversity of thought and independence, which she has aptly displayed in her written statement that she has just read to you. And the board considers that she most certainly has the skills required to be independent on both remuneration and nomination committees. There are no further questions.
Okay. The proxy received in respect of this resolution are on the screen. Please cast your votes if you haven't already done so. I move to the next item of this agenda. Resolution 3. The next item of business relates to the re-election of Mr. Sue Smith as director, who is retiring by rotation in accordance with clause 57 of the company's constitution and is eligible for re-election as a director of the company. I invite Ms. Smith to address the meeting to present why she should be re-elected to the board of directors.
Dear shareholders, It's a pleasure to speak to you today in support of my re-election as a director of Clinuvel. I have spent my career in the healthcare sector, first in frontline patient care and subsequently in the management and administration of hospitals. As a chief executive in the independent healthcare sector in the UK, my experience encompasses the broad range of governance and risk that is essential to the safe delivery of patient care. I bring diverse operational experience and insight to the board of Clinuvel to enhance the detailed scrutiny of its activities and strategic direction. My other board and operational activities ensure that I am abreast of wider healthcare issues that additionally have value to the growth and success of Clinuvel. I fully endorse the opportunities that Clinuvel is exploring to maximize the health benefit to patients with a range of unmet conditions through the application of melanocortin peptide hormones. I was appointed as director of the board of Clinuvel in September 2019 and have served on the remuneration and nomination committees. I share the chair's view of the importance of retaining the depth of experience and capability built over the years by our key executives and the recruitment of talented people to support the growth and expansion of the group. I am proud to bring my experience and commitment to a company that holds such transparent and first-class ethics with a focus on the care of patients, particularly those who have been underserved for so long. I am keen to remain part of the group's bright future by guiding its strategic direction and ensuring good governance and accountability as an active member of the board. If re-elected, I will continue to commit my time and continue to serve as a productive member of the board, maintaining my independence and bringing value to the decision-making of the board. I am pleased to submit my candidacy for re-election and look forward to your support to continue to serve Clinuvel. Thank you.
Thank you, Ms. Schmidt. I ask our company secretary, Mr. Kami, if there are any written questions.
Mr. Chair, there are no written questions in relation to this item of business.
Okay, thank you. Any telephone questions on this item of business will be taken after the CEO presentation. The proxies received in respect of these resolutions are on the screen. Please cast your votes if you haven't already done so. I move to the next item of this agenda. Given the proxies votes received for Resolution 1 and further votes to be cast in today's meeting, the conditional spill resolution will be put to the meeting. Therefore, I put this resolution to the meeting as an honorary resolution. The directors recommend the shareholders to vote against this resolution. Ms. Schmidt, are there any written questions received in this item of business?
There are no written questions in relation to this item of business.
Any telephone question on this item of business will be taken after the CEO presentation. The proxies received in respect of these resolutions are on the screen. Please cast your votes if you haven't already done so. I now hand over to our CEO to make his presentation on the year and on the future. As a reminder, at the end of his address, we will be taking general questions on the business. This will be followed by closing of the poll, and I will conclude the meeting.
Thank you, Mr. Blijdorp. Good morning to all of you in Europe and early morning in the US, and good evening to you in Australia. I hope that we'll be able to meet each other in person next year at the AGM. And it's been a long road in the last 2 years of restricted mobility. With having said that, we're looking back at the year of Clinuvel's success, and that really stems from an approach to risk management that comes close to a deterministic business model. And in equity markets currently, Clinuvel's proposition is dominated by the history of the company, but also by the ability to execute. However, the chance to execute on a program that had started 41 years prior in pharmaceuticals is extremely remote. And today we find ourselves yet on another juncture of Clinuvel's third act, and that is the expansion of assets and the growth of the company. Now, we understand that there are a number of new shareholders on the phone and on the line today, and I would like to make a small excursion in the makeup of our registry, because 17% of the shareholders that remain invested today in Clinuvel really originate from the years 2001 to 2005, when they invested in Epitan. And as you know, that was the precursor of Clinuvel, aiming to serve the market with a lifestyle recreational drug, which proved to be a fallacy, and that brought the company at the brink of bankruptcy with less than 6 weeks of cash remaining in October 2005 and an enterprise value of lower than 30 million. But these shareholders have opted to remain invested in Clinuvel since they had a confidence in the turnaround. Now, 26% of Clinuvel shareholders, they've invested through a number of private placements over the years, and the 26% have been invested more than 10 years in the company, and they opted to remain invested because they have confidence in the business model and the management to execute the same strategy. So the shareholders that are invested in the early days have seen a return on investment 50 times their initial money laid out, and those 26% that opted to invest in Clinuvel have seen a appreciation of value of 19 to 7 times the initial dollar that they invested. Now, the overwhelming majority of shareholders in Clinuvel have invested because they believe in further value to be created over the years. So today we will speak about the commercial progress, the value creation, and also the capital allocation. The next slide, please. I will leave you in your own time to look at the legal notice, and I progress to the mission and objectives. Great. And so the mission and objectives are very much the compass we navigate on, and it keeps the talented professionals together, but it also attracts the new talent to this company. And the value creation very much stems, in our case, from the environment that we create, a safe environment for staff to commit errors, to experiment, to explore, and to express, and an environment that is conducive to technological and commercial performance. Next slide. So the value creation that the Clinuvel has enjoyed is very much the fulcrum between the business and the differentiation of the company in the markets. And we have concentrated on the business side on 3 aspects over the years. That is in the increase of our assets to a specialty pharmaceutical company, to pay attention to the parts of the value chain, and we'll talk about it a little bit later, and to expand our offerings to wider populations as encompassed by the healthcare solutions division. But the 3 main elements of value creation are really found in the resources, the positioning of the company, and the opportunity and the size of opportunity that we pursue. But as you know, we did it in a sequential basis. We first looked at the orphan and drug market to demonstrate a proof of concept before we expand to wider populations. But critical to all our endeavors remains the differentiation in risk management, the way we approach and manage the risks. And we stated it publicly, the risk register is the Bible of the company, the pivot to which we pay attention to every quarter, and the financial discipline across all the divisions of the company that remain central in the past and in the future. Next slide. So if we turn our attention to the value chain, initially we had paid attention to the tail end of the value chain by intermediating the staff and management and cutting out the third parties that would control our distribution, supply, negotiations with hospitals, and last but importantly, the discussions with the payors, the insurers in the world. And then gradually we moved up to the value chain and paid attention to the middle section. And in the middle section, we're almost nearing the completion of the business model with one or two of the disciplines to be brought in-house. And in pursuing a vertically integrated business, as we have announced in 2020, we now turn our focus to bring in-house the manufacturing and analytical capabilities, which then would render us sovereignty over the entire value chain. Now, we didn't need COVID to remind us of the importance of controlling the value chain on both ends. But since the geopolitical tensions have risen and seem to be lasting between the various continents in the world, and in Australia suffered that, we are more steadfast than ever to incorporate the critical functions of the value chain and vertically integrate the company such that we control the beginning and the end. Frequently, we've been posed a question as to why Clinuvel would invest its resources in photomedicine and whether the returns on capital employed justify the lengthy development. Now, with the current levels of profitability in the 5th year of commercial market, it is, in my view, objectively no longer an argument as to whether the investment justified our business model. And with $150 million spent between the start in October 2005 to the first entry to market in June 2016, it is hard to argue that the returns on this company are not enviable. But the starting point in our endeavors is always to characterize the medical problem we seek to solve. And in EPP, patients suffer, as you know, from a light intolerance, particularly in the blue spectrum, the HEV, the high energy visual field. And then we turned our attention to XP, and the medical problem to be solved there was the inability to repair a DNA induced or provoked by UV. And that comes together in a triptychon where we seek to assist the DNA repair through our medicinal products and through our OTC products. So we've spoken over the years much about EPP and the commercial success and rollout both in Europe and in the US. And I would not spend too much time on it. You can find most of the information online. I do want to draw your attention to the graph on the left-hand side, on the bottom left-hand side. And what you see there is the increase in quality of life over the period 2016 and to 2021. So 5 years of real-world experience. Now, quality of life is, in our view, a much used term in medicine, but in EPP it means a totally different, has a different meaning, namely that this is the first time that these patients are able to enjoy a life that was inconceivable prior to treatment. And you have to imagine that you're born with that disease, a genetic affliction, and that keeps these patients indoors and isolated. And this is really the first time that we can demonstrate a longitudinal follow-up of patients under real-life conditions with a gradual increase in quality of life. Now, what is the most important part of the COVID pandemic over the last 2 years is what I call the pure and objective translation of clinical value into economic value. And this is the first time where we have seen, without intervention of physicians, and certainly not without any intervention of the company, where patients have demanded ferociously to continue the treatment during the most restricted conditions. And I call that the most objective measure of seeing whether a treatment is efficacious. Yes, please. So in XP, we are entering a new entity, and as you have seen over our announcements the last few weeks, the first patients have been treated in Europe, and that's been quite a challenge over the years to be able to expose these patients with a very short life expectancy to a new experimental therapy. And the national competent authorities, the decision makers, the ethics committees, the physicians, but also the patient associations themselves resist the subjects to be tested with new experimental drugs. And so this is where the past and the present intertwines, because by showing successful systemic photoprotection in EPP, we had the data, the evidence, and the narrative to go to all these authorities and patient associations year after year, until it led to a breakthrough to finally be able to test and evaluate afamelanotide in these patients. And so we had an inkling of the capacity, the potency of this drug to assist the DNA repair from various experiments. And of course, we wanted to see it in the clinic. So that's been a breakthrough where the EPP program has actually actively assisted us to enter the xeroderma pigmentosum. But in investment cycles, there has always been some questions of whether the company should really embark on another orphan drug disease and whether it would be speaking volume to the financial markets. And we'll speak later about the addressable market and the effect of going into XP long-term and mid-term. Yes, please. And so if we look at the clinical trial program, and we spent a few moments on it, the clinical trial program consists of 4 trials, 3 of which are actively evaluating the drug in XP, XPC variant and XPV variants. So that's 2 of the 8 variants in XP. And 1 trial, the 151, serves as a control in healthy volunteers. And here we will be measuring the repair of DNA induced and provoked by UV radiation. And that has been quite novel and a challenge to achieve and to get all the regulatory and ethical permissions. But we are now quite confident that we have 4 countries over the line to assist us in running these trials. And after 15 years, that is a breakthrough in the company. Yes, please. So this is really a summary of the journey, the foray into photomedicine. And I would concentrate on the left-hand panel. The left-hand panel is very much the early stage where we wish to see the treatment effects or the addressing of communities, whereas on the right-hand side, the orange section, you see the genesis, the development of skin cancers, which is often too late because it's irreversible skin damage induced by UV and HEV. Yes, please. And so the global leadership in photomedicine is a niche market that we pursued. It's very where we can obtain authority through the EPP, XP, and OTC markets. And to our surprise over the years, it's also a market that is very sparsely populated by other companies. So what we see here is the differentiation of the markets that identified long term, and we categorize them as patients that are long-term immune suppressed. So they receive a cocktail of drugs lifelong. Many of them have received an organ and therefore have compromised immune system due to the drugs. These patients, we call them the kept secret in medicine. These patients of skin cancer and solar damage. Then there is a second group, that is these patients that have a history of already their skin cancer, and that is called a field cancerization. And these patients are also at the highest risk of incurring skin cancer. And then the third risk to photo damage is those patients that live extreme outdoors existence, the sporters, those that are exposed to reflective surfaces, snow, water, sand, altitude. And we identified these three target communities as the ones we wanted to communicate and establish the communities in the first place, and we'll talk about this, and those communities that would benefit from our OTC products. And so, of question from all the market participants is how and when is Clinuvel going to do this? And let us first talk about the when. As you have gleaned from the discussion today, we are pursuing a very defined and described market in photomedicine, and that consists of systemic photoprotection in EPP, systemic photoprotection in XP with the assistance of DNA repair, and the three target communities that are so well defined and that were unserved. And so the when is, of course, in parallel. The moment that you are generating the first meaningful results in XP, it makes absolutely perfectly sense to introduce your products into these highest risk populations. And so we are parallel working to develop a market for XP and OTC markets where the of products will give absolute authority to a company that specializes in photomedicine. Now, the question, of course, is then, how are you going to do it? Well, we are establishing communities through targeted digital communities and campaigns, and we will have a number of campaigns frequently following each other, providing us the return on the investment. And for those that are well versed in IT, that is seen into the number of impressions, the number of engagements, the conversion rate. And in order to establish these markets, we are selecting 60 of the ambassadors distributed evenly over the three populations, the immune suppressed, the skin cancer family, and those that have a high degree of outdoor exposures, the extreme seekers of thrills. And so in those three communities that have never been addressed properly by pharmaceutical companies or by cosmetic companies, we had seen a opportunity to serve in parallel with our photo protection programs in EPP and XP. So this is quite a pivotal moment in the history of the company, because here we are looking at the expansion of our pipeline. And the first part to explain is that the global leadership in photomedicine needs to come in three. It can't be three separate entities working on three separate projects. The aggregate is bigger than the sum of the parts. And so I will leave you in your own time to read this important illustration, because it not only provides you the sequence of our decisions, but also the addressable markets. Yes, please. So now a few words to our clinical program, because one part of the business is to obtain authority and leadership in global photo protection. But the important part is, of course, the translation of our melanocortins, in this case, afamelanotide, into various other disease entities. And what you see here projected is first the vitiligo programs. So perhaps we stand still for a second on vitiligo. We've explained over the last few weeks publicly that vitiligo is a complex disease to treat, and that we had a dilemma with the regulatory authorities of presenting a therapy, a combined therapy that worked, whereby one of the combination modalities, namely narrowband UVB, has and had not been approved for the use in vitiligo, although in North America and Europe is commonly practiced as the standard of care. And since the company is not in the business of promoting or developing or registering narrowband UVB equipment for vitiligo, the dilemma was, and the challenge was, well, how do we solve it, since we know that combination therapy works very well? Well, after years of talking to the FDA, they had come to a conclusion to do their own homework and interview 800 patients as to the efficacy of the current treatments, which is quite low. That is also why the vitiligo market poses an opportunity for pharmaceutical companies, and also questioning the patients of what exactly would constitute a success in terms of level or degree of repigmentation. And we've incorporated these figures of the FDA into our prospective trial starting in 2022. And we now have a breakthrough solution of treating these patients with our drug. And our target will be the patients of darker skin complexion, so technically called Fitzpatrick 4, 5, and 6. So those patients that show the highest contrast between lost pigmentations and those that still have some fields of pigmentation. And our endpoints will be the face and the head and neck. Now we turn our attention to the second program, Variegate Porphyria, which is very much an extension of EPP, except that these patients who are light sensitive in the visible spectrum do not only express lesions, but also blisters. And so the two sites that we will be trialing in 2022, we're ready to go when the sites open up post-pandemic. Now, the third program that most of you are aware of is the program in stroke. And stroke is quite a novel progression of the company to deploy the drug in patients that have no other means of resolving the clot in their brains. And in the higher regions of the brains where the blood clot is lodged, we are trying to sort an effect, a therapeutic effect in these patients. And the first signs are reasonably positive, where the neurological function in these three patients has improved, but where the disability still has remained more or less the same as when they were when they were admitted to the hospitals. Now, of course, there are questions about the new indications, and the new indication is still pending the regulatory and the hospital sign-off. So we more or less have all agreed to the protocol, but most importantly is to secure the intellectual property position for years to come. And before we are completely certain about the IP position of the company, we will not be able to announce it. But I'm very hopeful that we are at the tail end of this process. Yes, please. Well, this is quite a cardinal moment in the company, but not unexpected for those that have followed the company intensely. So what we have done over the years is gradually and steadily expanding our portfolio of melanocortins, first with afamelanotide and with the small molecules, all for different uses, but importantly also in different formulations. It is not only about the chemistry that you administer to a human being, but there's also the way we administered, and we call that the dosage forms. So we have now a number of molecules in various iterations, and these various iterations means that we manage the life cycle of afamelanotide and progressed the smaller molecules for other uses, cutaneous use. And since a few days you have seen our long-term projects coming to fruition, we now secured the manufacturing agreement for ACTH. And ACTH is really the mother molecule of melanocortins, and that is being used for a long time in a number of diseases. And we see a sizable opportunity due to the expansion of the medical field, but also due to the shortage of supply of ACTH due to this financial distress of a number of companies. And so important in this entire constellation is that we as a company are now moving into a field that is not yet occupied, because when we do our objective diligence and speak to the independent investment bankers, the consultants, we propose the direction of a company. We first form that opinion as a board and management. Then we ask the investment banks to come in and see and opine of what they would see as the best value for the company or the best use of resources of the company. And unanimously, we've come to the conclusion that one melanocortin house, all the melanocortins under one roof, would not only provide substantial clinical value and see an economies of scope using various manufacturing for other molecules, but also provide the company a unique position in the North American and Australian market, because there is no comprehensive melanocortin house entity that encompasses all the molecules under one roof. So we are quite exciting that we are actually living up to our own objectives, albeit at a long time. Yes, please. So this is a slide that you are used to, but it serves also internally as a mere reflection of how we manage our finances, how we grow our revenues, at what rate, and how we go about our business. And with a very cost-conscious finance team that we have, the plan is to observe that fiscal discipline over the years, but gradually expanding the cost base of this company in order to fulfill our pipeline. And we please proceed to the next one. And so then it comes back to the question of how is the company going to use its current resources of $93 million, as you've seen in the last quarterly update. And this is the first time where we reveal how our projected expenditures will run. And you see that the expenditures are plateauing more or less in 2025. And we very much follow the thought that projecting a financial budget year on year beyond the Olympic cycle is really of no use, because there are so many moving parts in the business or in the environment that is difficult to project. However, we plan these expenditures in order to fulfill the three categories, that is the leadership in photomedicine, the expansion to life-threatening disorders, but also to expand our house with more prescriptive melanocortins and OTC products. And you see that projected on the left-hand side. But important for those that do the quick math today on the illustration is you see a planned expenditure projection of $170 million over 4 years. And that then begs the question, well, if the company holds $93 million currently, will it be confident enough that it will generate the future cash flows to make up the $170 million? And clearly we are, otherwise we would not show it to you. So with the future cash flows coming to the company, plus the reserves that we have consciously and cautiously built, we are quite confident that this is the trajectory and the value that will follow for both patients and the shareholders. Yes, please. So I've come to the end of the summary of the direction of the company, the way we're going to do it, when we are going to do it, and that is not possible without the support of long-term shareholders, those that have invested more than 5 years, and that's quite a number in this company, an unusual high number percentage, and the board of directors that challenge at all juncture, all the third-party advisors and consultants, but most and not least the staff that work all hours to make this possible in a growing environment under restricted conditions. But when we look back at the year 2021, it's been beyond our expectations. And on this note, I really very much thank you for your attention, and it's a privilege speaking to you.
Thank you, Dr. Wolgen. We will now respond to general questions, starting with the written questions received, and then we will attend to audio questions. Upon the final question, I will move to close the poll. If you haven't already done so, could you please submit your votes? We will start with questions received prior to the meeting. Please be aware that there may have been questions received prior to the meeting that will not be presented here because we have addressed him with the CEO presentation or in my earlier address. Ms. Smits, are there any written questions?
Yes, we have a number of written questions, and I will start with the 2 questions that were received prior to the commencing of this meeting. May I ask, in the because of time restrictions, that the answers that we give be kept as succinct as possible, please. My first question for you is from Mr. Andrew Alpuni. When is the additional indication going to be announced?
Thank you, Ms. Smith. I think I just touched upon this. The new indication will be announced once we are confident that the commercial agreement is in place, and most importantly, that the company is securing its intellectual property position long term. And we are nearing that completion. Yes.
Thank you. Our second question is from Miss Michelle Gray. I have been a shareholder for 16 years now, and like many, I have done better in this stock beyond my wildest dreams, and I can see that it will continue. But what really bothers me and threatens the ongoing success of the company is a group of silly and unreasonable shareholders online, which deliberately distributes false and negative information. Can there only be one reason, and why don't they sell if they have been unhappy for 16 years? What is the company going to do about this group of anonymous posters? It demands attention and must be addressed. Dr. Wolgen, may I ask you?
Could you, what is exactly the question?
What are we going to do about the online false and negative information that a group of people have been posting?
The simple answer is not to believe everything you read, but I guess that is not the inference in this of this question. We live in an era where information can be construed and presented through various media channels. I don't see that as the task of a company to control by any means. We generally do not control or influence the press or analysts to that extent, or social media. We let that evolve as it goes, because it really does not touch about the core business that we try to execute and run on a daily basis. The example of GameStop comes to mind, where the influence of social media was magnified and certainly caught out the hedge funds and made headlines in the world. With due respect, Clinuvel is not at that level yet. But in general, I think that it's fair to say that the dissemination of information that is not factual can perhaps originate from true motivations. And I don't think we can speculate on why people do it, but it is clear that irrationality in society occurs, an irrationality of those that post continuously negative information on the company is in contradiction with my old-fashioned belief of holding shares. If I am generally unhappy with an asset class or a management team or direction of the company, the logic thing is to sell the shares. Now, and I guess that's what the shareholder alludes to, if that persists while the shareholders remain invested in the company, then there are only two options. It's either based on irrationality or because there is a financial gain somewhere. And I do not believe that it's the task of a company to speculate on it. Eventually, as you've seen over the years, value is being created gradually and quite significantly. And this is really of no consequence to the business at all.
I'll move to the next question, if I may. This is a question from Mr. Christopher Gillingham Greenway Williams and Mrs. Lynn Elizabeth Williams. The question is, do you intend to produce ACTH in-house? And if so, why do you believe you will avoid the financial distress suffered by other manufacturers?
That's actually an excellent question. Mrs. Smith, Greensmith?
Mrs. Elizabeth Williams.
Mrs. Williams, it's a very good remark. We believe, and we are going to speak from a macroeconomic to microeconomic standpoint, we generally believe that controlling the value chain is of long-term interest of shareholders and provides stability and sustainability to a company. Of course, the question then is, when are you doing it and how are you doing it? Are you doing it abruptly, dramatically, or you easing into that first part of the value chain? Now, when it comes to ACTH in particular, that is already an established market. The financial distress by these companies are not born out of the manufacturing of ACTH, but very much born out of their involvement in the opioid scandals that brought the company into a distress. So we're quite confident that the manufacturing of the final product, that is not the sourcing of the raw materials of ACTH, the peptides, but the manufacturing of the final product, together with the manufacturing of our other melanocortins, so the final product again, will need to be done in-house in time.
Thank you. Mr. Tollefson has asked a question on Mitsubishi Tanabe. If the Mitsubishi Tanabe EPP drug does make it to market, is it likely to have an impact on Clinuvel's margin on SCENESSE sales?
Mrs. Tollefson, how long is a piece of string? The area of EPP was never of interest to any pharmaceutical company. And that is one of our selection criteria when we look at a market or servable market. And a competitor will always emerge. Now, whether this particular competitor is going to be successful is to be seen. Whether the patients wish to see a different formulation is to be seen. Whether the competitor will reach a successful agreement with the insurance companies and payors is to be seen. Whether the drug is going to stand the scrutiny of safety of regulators and the pharmacovigilance is to be seen. There are so many unknowns and ifs, but we keep an eye on every competitor in the world. It is not a concern, it is part of our business. And what is also important is to realize that the EPP market is still not highly penetrated. So we believe there is room for 2 or even 3 competitors without eroding our market. I hope to have finally answered your question. So we've seen it over the years.
Thank you. With your permission, Mr. Chair, I'm going to direct the next question to Mrs. Shanahan as an independent non-executive director. The question comes from Mr. Simon John Bown. Recent comments in the media has raised questions over the nature and origin of the relationship between Mr. Blijdorp and Dr. Wolgen, including that it predated Dr. Wolgen becoming CEO. At no point has the company presented shareholders' commentary on the nature or existence of any such relationship, and yes, would surely be critical in any assessment of suitability for a non-executive director role. Can an independent director answer if the chair is truly independent? Thank you, Mrs. Shanahan.
Thank you, Sue. Dr. Wolgen met Mr. Blijdorp in the course of business. After some years, Philippe proposed consideration of his appointment to the board. The appointment was approved by the nomination committee as Willem's outstanding track record was complementary to the existing skills of the board. Willem continues to demonstrate ongoing strong independent judgment and commitment. Thank you.
Thank you very much, Mrs. Shanahan. For the next question, again with permission of the chair, I will take the answer. This is from Johannes Lankilde. As a non-Australian shareholder, I am not able to attend the AGM, nor am I able to vote. The chair stated at the last AGM that he was frustrated that only few shareholders actually vote. Why hasn't the company then taken action to allow US and German shareholders to vote? Mr. Lankilde, Clinuvel's AGM is open to members of the company defined as registered holders of CUV shares. ADR and UR9 holders cannot be verified as shareholders under the share registry maintained by Computershare. So they are unable to attend the AGM as members of the company. With regard to voting, CLVLY holders can approach Bank of New York Mellon, and by UR9 holders can speak to their brokers to discuss. Holders or their agents need to identify themselves and pay any fees requested for the service. We are not in control of these practices, however. Any shareholder that desires to engage us is welcome to reach out. Thank you. The next question is from Mr. Tollefson. It's a general question. What activities are undertaken by the island and Monaco located operations? Mr. Wolgen.
The Monaco entity has been set up following the Brexit saga and the unfortunate severing of the ties, economic ties between England and the continent. And we've set up operations in Ireland and Monaco at the invitation of the Minister of Economics in Monaco. That discussion had been ongoing for 3 years. And giving the foray into cosmetics, skincare products, And those three high-risk populations, we wanted to be close to the center of the cosmetic industry. And as you know, that is Sofia and Antipolis in France. And so in that region, we are going to and are engaging in activities which I do not want to divulge at this stage, but that are going to be closely connected to the way we are going to market our products in the future.
Thank you. I have one final written question from Mr. Aaron William Thornton. Given that it's been the company's best performing year, the coincidence of timing for local negative press makes one suspicious. I wanted to ask if the company knows if the stock is being manipulated. Dr. Wolgen.
Manipulation, according to the ASX listing rules and the Australian Corporations Act, is to influence the purchase of the transactions of stock that leads to economic benefit. And we leave the assessment of manipulation clearly to the financial regulators in Australia, ASIC, in the US, FINRA and SEC. If the inference of this question is the sentiment around Clinuvel being influenced by the timing of the press, I do think I share the suspicion of Mr. Aaron, because the company that usually doesn't attract press sees a flurry of interview requests and written press around the moment that the company is suffering a short attack. So yeah, coincidence does happen in financial markets, rare and seldom. If I look at the history of the last 20 years in finance. So I would not share the word manipulation, but as I alluded to before, it is a common phenomenon that individuals or group of individuals attempt to influence others, so other market participants, to sell or to buy, in order, to distort, dislocate the story. And Clinuvel is not alien to that. It happens to many companies. So my suggestion to Mr. Aaron is to be careful to accept at face value what you read, but also always question the motive of the author or those that post. And once you stay with that approach, question always why someone is writing or posting. It's quite a useful guide to come to the source.
Thank you very much. So in the interests of time, I think we should now go to telephone questions.
Are there any telephone questions?
Thank you, Chairman. We have one telephone question from Michelle Gray. Michelle, please go ahead.
Oh, thank you. I think you answered my question earlier, so I'm good.
Thank you.
Thank you.
Okay.
There are no further telephone questions.
We have reached the time where I shall now conclude the meeting. We will close the poll off in 30 seconds. The final poll results will be verified and released to the stock exchange after this meeting and no later than opening of the market tomorrow. All items of business have now been addressed. Thank you for your participation and for your feedback. I hope this virtual meeting was a positive experience, and I regret that the board and management could not meet with shareholders today, and I hope we can meet in the near future. I declare the meeting closed. Thank you for your attendance.